Right. Thank you, Roy. Okay, in today's presentation, what I'm going to talk about in part one is I4I and the importance of PPI in I4I projects. And in part two, I'll talk about the what, who, where, when, and how of PPI. And in part three, I'll signpost you to some guidance and resources. Next slide, please. Next slide. So the NIHR expects active involvement of patients and the public in the projects it supports. And it anticipates that most I4I projects will have a significant PPI component, which must be clearly and fully described. An applicant should identify the relevant patient user groups for their application and engage with those groups at an early stage. And we can see also from there that PPI is one of the many criteria that the NIHR will assess applications on. Next slide, please. Whilst PPI is a requirement, see what difference PPI makes to an I4I funded project. Let's turn to this evaluation report commissioned by the Policy and Research Programme at the Department of Health. The evaluation was conducted by RAND Europe in 2015. This report aimed to identify the factors and outputs of I4I funded projects that influence performance and progress, one of which was PPI. A range of methods were used to conduct the evaluation, such as a focus review of background information on I4I, scoping interviews with key informants, a survey of programme participants, and case studies involving diverse technologies and health needs. Next slide, please. It is these case studies that I now turn to, and the following quotes are extracted from 4 of these case studies. So, quote number 1, the team involved patient representative groups in the proposal development process, which helped to include an end user perspective in the design considerations. Early consultation with patients helped the project team better understand needs and how they relate to product design and function aspects across different areas of application and patient segments. PPI created the opportunity to collect feedback on product design and testing throughout the project. Spending substantial amounts of time with patients helped to discover what the main issues that they found important were and helped the project team explore a range of prototypes. And lastly, in hindsight, the team members noted that it would have been good to have worked with even more patients at the start of the project to get a more objective understanding of the type of device that would work for different groups, different types of patients. So these quotes give very clear reasons as to why PPI is important in I4I projects. They demonstrate the contribution of PPI in product design, facilitate an understanding and the relevance of their product for diverse patient groups, and identify the relevance of their product to patient needs and priorities. It also shows the value of a focus of PPI early on in their research project. I shall now move on to part 2, which focuses on PPI in more detail. Next slide, please. What is PPI? Well, NIHR defines public involvement in research as research carried out with or by members of the public rather than to, about, or for them. It is an active partnership between patients, carers, and members of the public with researchers that influences and shapes research. It's not about informing people or asking them to participate in the research. Next slide, please. So who are the patients in the public? Well, the term PPI includes patients, potential patients, carers, and people who use health and social care services, as well as people from specific communities, as well as organisations that represent people who use services such as charities and support groups. Also included are people with lived experience of one or more health conditions, whether they're current patients or not. But it does not include stakeholders such as healthcare professionals, care workers, and commissioners. It is important to consult them, but they are a different type of stakeholder to public contributors. Next slide, please. When we talk about who needs to be involved, the NIHR states researchers need to actively focus on ensuring PPI is inclusive of diverse communities based on protected characteristics such as age, ethnicity, disability, and sexual orientation. And it's also important to ensure that EDI is embedded throughout your proposed research so that what you are developing is relevant to all patients and communities and not just a select few. And also to ensure that they don't inadvertently discriminate against certain groups of patients and the public. Next slide, please. The ramifications of a lack of embedding EDI and PPI and product development are illustrated in the headlines in this sample of media and academic journals. I don't have enough time to go through all of these, but let's look at the BBC headline, given the disproportionate impact of COVID in BAME communities. Oxygen monitors are designed to spot signs of dangerous falls in oxygen levels in COVID patients. However, these work less well in those with darker skins. Both NHS England and the medicines regulator, the MHRA, said these monitors may sometimes overestimate oxygen levels in darker skins. This is because devices that beam light through the blood and skin pigmentation may affect how light is absorbed. Clinicians are increasingly becoming aware of the potential errors or inconsistencies associated with these monitors. And in the BBC article, a clinician in a hospital discusses he frequently comes across these monitor errors in Black patients. When we talk about the algorithms, so having a diverse range of PPI is a good starting point. It's not a panacea, but can assist with access to diverse perspectives in the development of a medical device and digital health technologies to ensure their relevance to a wider range of patients and the public. A recent Parliamentary Science and Technology Committee on Algorithms produced between 2017 and 2019 discussed that when algorithms involve machine learning, they learn patterns from data which may be incomplete or unrepresentative of those who may be subsequently affected by the resulting algorithm. So there can be an inbuilt bias and lead to discrimination. Also, algorithm developer teams may not include sufficiently wide cross-section of society or the groups that might be affected by an algorithm to ensure that a range of perspectives is assumed in their work. Later on in this webinar, we shall hear from Patrick how this is addressed in their research. Next slide, please. So where is PPI positioned in research? I developed this slide when approaching members of the public to take part as public contributors in a research project. This is a later version. In earlier versions, it depicted different types of a research project. So basically, I use this slide to explain the positioning of PPI in the research process to those unfamiliar with the concept of PPI. I found that it was difficult to explain how PPI differs from research participation to members of the public as well as researchers. It's a useful way of explaining where they are positioned in the research process. So here the point I'm making is that patients and public are positioned alongside the research team on the left-hand side of the slide, working collaboratively to shape and design the research. And together with the research team, public contributors can influence the research for example, is illustrated on the right-hand side of the slide, involving a medical device or digital health technology. And so what this slide does is also make the distinction between PPI and research participation. So when do patients and the public get involved? As required by the NIHR, patients and public should be involved from the beginning to identify the research questions. However, my experience is that research teams develop their questions and priorities and research plans before they consult or collaborate with patients and the public. And it is really important to work with a group of patients and public as early on in the research cycle as much as possible, and to involve them in all stages of the research cycle, including developing and writing your funding applications, as you will be required to show how PPI has informed and shaped your research. Next slide, please. So how can PPI assist? Here's a sample of some of the areas in which you can collaborate with a group of public contributors. They can assist you with your funding applications, such as your research plans, selection of appropriate patient outcomes, and writing the plain English summary. Other important aspects also include the ethical implications of your proposed research and research participant burden. They can also be joint grant holders or co-applicants on research funding applications. Post-award, they can assist you with ethics applications, data collection methods, development of study documentation, and dissemination strategies. So now I'm going to move on to the guidance and resources that you can refer to for assistance. So I've put here, again, if you haven't got the message already, start early with your PPI. And if you need guidance on EDI, there is the Trial Forge website, and the Research Design Service have our own website, our own toolkit on EDI that you can refer to. But if you're unsure of how to involve patients and public, speak to your RDS Public Involvement Lead. And you can also speak to the RDS PPI Lead about accessing a small grant called the Public Involvement Funding, PIF for short, to support your pre-award PPI activities. And use the NIHR payment guidance for researchers and professionals to ensure you support your public contributors for their involvement and allocate a budget in your funding application, including once the research is awarded funding. And ensure the PPI budget in your funding application adequately reflects the level and depth of PPI you are going to undertake. This is really important because the NIHR will look to your plans that you've written up in your application form, and then look to your budget to see whether, if you have got extensive plans for PPI, whether your budget actually adequately reflects the level and the depth of PPI that you've described in your application form. Next slide, please. So, public co-applicants are not a formal requirement for the NIHR funded projects, but should you have a public co-applicant, it's useful to have clarity about their role and their responsibilities from the outset. And Cecily will talk more about this later on in the webinar. So, for example, public co-applicants attend meetings to shape and inform the direction of the research, oversee its progress, contribute to its delivery, represent it to external agencies, and disseminate its findings. They can act as a liaison between a PPI advisory group and the research team. As I said earlier, the exact role and the responsibilities of the co-applicant will need to be discussed with the research team. And public co-applicants are not the same as the PPI lead, who can be a member of the research team that has a responsibility for coordinating PPI advisory group, arranging meetings, venues, payments, etc. And there's a link to what the PPI role and responsibilities can be, PPI lead's role and responsibilities can be So please use this link. And finally, what does good public involvement look like? Well, these are the 6 standards will help you to understand that. And they've been developed by the NIHR and UK-wide partners. They provide clear, concise statements of effective public involvement against which improvement can be assessed. Researchers can use the standards to review their plans for public involvement. Research funders and charities can use them to assess how public involvement is being implemented in projects and organisations they support. Members of the public and community groups can use the standards to assess the strengths and weaknesses of their involvement in research and to identify improvements. And we encourage researchers to refer to and demonstrate how they meet these standards in their funding applications. And finally, thank you for listening.